Petition number 2104, which is to end the pause on prescribing puberty blockers to children in Scotland, which has been lodged by Sophie Molly, who I think might be with us in the gallery. Not in the gallery, but I noticed that Maggie Chapman is in the gallery, who I think is an interest in the petition. This calls on the Scottish Parliament to urge the Scottish Government to ask the relevant health boards to reassess the decision to pause the prescription of puberty hormone suppressants and gender-affirming hormones for children and young people with gender dysphoria in Scotland, and ensure that it is still possible to provide new prescriptions while a review of the decision takes place. The petitioner tells us that the health and well-being of trans and gender non-conforming children will be adversely affected by the decision to pause new prescriptions of puberty hormone suppressants and gender-affirming hormones to young people. The decision to pause this treatment option is linked to the outcomes of the CAS review of gender services for young people in England, and as members may be aware, the Scottish Government has confirmed it accepts the CAS recommendations in full, with work underway to implement them. Now, in its response to the petition, the Scottish Government has stated its commitment to the improvement of gender identity healthcare in NHS Scotland for all who need it, and draws our attention to a grant awarded to the University of Glasgow to administer a programme of research into the long-term health outcomes of people accessing gender identity healthcare. The response also highlights engagement with NHS England on its planned study into the use of puberty blockers in young people's gender identity healthcare. Now, we've also received a submission from the petitioner highlighting concerns about the quality of data and evidence that was used to inform the recommendations of the CAS review, which, in their view, suggests the resulting decision to halt prescriptions of puberty blockers was ideologically rather than clinically driven. Members may also be aware, and I think this is an important consideration for this committee, that our colleagues on the Health, Social Care and Sport Committee have actually been hearing evidence on the independent review of gender identity services for children and young people. And that, I think, is a matter that obviously may dictate what options we feel are open to us if another committee of Parliament is currently considering the issues raised by the petition. Colleagues, got any thoughts or comments? Mr Torrance.
Thank you, Convener. As a member of the Health, Social Care and Sport Committee, we are already looking into and reviewing the gender identity services for young children and young people. I wonder if the committee would consider closing the petition under Rule 15.7 of Standing Orders on the basis that the Health and Social Care and Sport Committee are currently taking evidence on the independent review of gender identity services for children and young people, including hearing evidence from the Chief Medical Officer at the end of October 2024.
Fair. Might we also write to the Health, Social Care and Sport Committee, just detailing the petition that we've received, and perhaps recommending that if they are taking evidence from the Chief Medical Officer at the end of October, would it be possible to write to the committee just asking the committee to, in questioning the Chief Medical Officer, make reference to the petition that we've received? With a view to trying to seek an update on the research that is being undertaken, specifically on this issue. I'm just conscious that while the Chief Medical Officer is coming to give evidence, it doesn't necessarily follow that the specific issue that is raised by the petition will feature in the questioning put. And I just wonder if it would be possible for us to, in closing the petition, invite the committee to consider whether they might give consideration to asking the issue raised by the petitioner to the Chief Medical Officer. Colleagues? Are we? I mean, given that there is another committee considering the issue, I'm not sure that there's much more that we can actively do. Given that generally speaking, we don't consider things in parallel with other committees at the same time. So, I mean, I think that's it's an important issue that's raised by the petitioner. I think the committee is kind of reluctantly minded to close it, but to seek to try and ensure that the Health, Social Care and Sport Committee do understand the fact that a petition has been raised and try to have the issue raised directly with the Chief Medical Officer when the Chief Medical Officer gives evidence. Are we agreed? We are.